Well, here's this pretty rainbow. Always think when you're looking at your plate, it should be colorful. Colorful here, colorful purple. Fruits and vegetables are what's going to be your biggest, should be your biggest component on your plate. Lots of dark colors. The richer the color, the brighter the color, the more vitamins it has, and the more antioxidants it has, and the more anti-inflammatory it is. And there's lots of reasons why, but I just tell you it is. So leafy greens, spinach, kale, Swiss chard, which is right here. It's so pretty. Can I pick it up? Look at that, it's so pretty. It's like bright red and it's green. So bright colors, dark colors. Broccoli is good as well. Blueberries, raspberries, cherries. Those are all super good fruits and vegetables full of antioxidants. Okay, and in the category of whole grains and beans and nuts, so whole grains, we talked about not to eat too much processed, so the opposite of that would be whole oatmeal, brown rice, whole wheat bread. It doesn't have to be whole wheat bread that has, you know, tons of seeds and nuts in it. That's a good choice, but some people don't like their bread to be kind of crunchy, so it could just be whole wheat itself. Those foods are high in fiber. It doesn't cause your blood sugar to go up very quickly, and having your blood sugar go up very quickly is associated with increasing inflammatory markers. These foods also have the vitamins that were removed from processing, so they have some more antioxidant. So whole is better. And then nuts and oils. Nuts are a great source of protein. There's lots of good all kinds of nuts are great. And then oils. Olive oil, avocado oil, walnut oil. I didn't list that there, but those are 3 great oils that are super high in the omega-3 fatty acids compared to the other ones that have the 6. So again, you need both, but I would try and choose those over the other ones more often. And yes, oils are high in calories because it's a fat, but you still need fat, and just don't be excessive with it. Don't pour, you know, tons and tons of oil on it, but when you use oil in cooking, I would choose those oils first. Fish is great. Specifically cold water fish, salmon, trout, tuna, mackerel. Those are the fish that have higher, again, those omega-3 fatty acids and higher antioxidant power to them. And the recommendation for heart disease and any inflammatory disease is twice a week. You should have your goal to eat those twice a week, and a serving size is actually only 3 ounces. It's not huge. It's kind of probably the size of your fist, the back of your fist, twice a week. That would be a good goal. And spices and teas. Don't overlook it, and don't forget about spices. And spices don't have to be savory spices like pepper and cayenne. There's also like sweet spices, nutmeg, cinnamon. Those are awesome foods that you can incorporate to add flavor, because when you take out some of the fat and sugar, you need to add something else to make it taste better. So it adds flavor, and they also do have a bonus that they have some anti-inflammatory components to them. Curry, turmeric, ginger, all great spices that you could add to different foods and add to different drinks. Teas, all teas have been shown, excuse me, oolong tea, green tea, black tea, all of them have varying amounts of antioxidant properties. And I mentioned on there storage and expiration dates, because it's better to store them in a dry, cold, or cool area that's sort of dark, closed tightly. And sometimes you don't use spices very often, and you have them in your spice drawer, your spice cabinet, and all of a sudden, if you think about it, they've been there a couple years. So you do want to rotate that, and even if it's not all used up, I wouldn't leave it much longer than 6 months in there to get a new one. It doesn't go bad, it won't be harmful, but it just, some of their antioxidant properties go down after long storage just sitting there. I mean, that's why they sell them so small, but the smaller serving size or the smaller jar size would be better. Okay, what about sugar? So I said don't eat sugar, so what can you use to sweeten your beverages or your foods? So there's lots of other options out there. There's lots of artificial sweeteners that are questionable, but I did list one on there, stevia, that is natural, the most natural out there, and what can be recommended for a sugar substitute. Not that it has anti-inflammatory properties, but it's a healthier artificial sweetener choice than sugar. Agave nectar, that's good too. That's not perfect because it is made with a lot of fructose, but it has less than sugar. Honey, monk fruit is really good. That comes in a powder or liquid. Very natural, less processing. Maple syrup, molasses. Try and get the maple syrup that's 100% pure, not just like Mrs. Butterworth. Try and get it a little pricier to get pure maple sugar, but it's better for you. And then even raw cane sugar is better than regular sugar. It's still sugar, but it's processed less, so that's a little bit better. And then, like I said before, spices. So you can add cinnamon to drinks, and cinnamon and nutmeg and different sweet spices to change that flavor. Okay, so questionable foods, nightshades. A lot of people ask about this. Nightshade vegetables are potatoes, some tomatoes, some peppers, eggplant. And these are kind of unclear. There's no evidence out there that these make symptoms worse, but anecdotally we've heard, and probably people in this audience will say that they notice an association when we eat a meal high in these foods, we have more pain or some pain afterwards. But I would say it's individual. Probably a lot of symptoms are individual, but this one specifically. So a suggestion I would have is to take all of them out of your diet for a couple weeks, at least 2 weeks, and see how you feel, and then slowly add one back in at a time and see if you notice any association to you specifically. Because those are good foods for health, especially tomatoes and eggplant, and peppers, but I wouldn't say you have to take them out completely. Kind of just experiment that with your own body.